So why do viruses like SARS-CoV-2 evolve to become more transmissible?
Yeah, unlike people, viruses make sloppy copies of themselves. So the baby virus often looks very different and is often defective from the parent virus. So viruses replicate, they make swarms of viruses and they look very different. So it's a messy process. It's supposed to be quick, but not necessarily exact. So mutants happen all the time, and most of those times mutants don't do anything. But once in a while, a mutant comes along that's better than the other viruses, better in some way that helps it survive, better in being transmissible from one person to another. So evolution is happening all the time, and it's sped up when it comes to viruses because they can make billions of copies of themselves. So if there's a 1 in a million chance that it's going to make a virus that's better than the parent virus, it's guaranteed to happen if you have billions of viruses being created. So this happens all the time. It's evolved. It's evolving quickly, and it's sped up evolution that allows this to happen.
Awesome. So is there any evidence that BA.4, BA.5 is more or less severe than previous Omicron subvariants?
Yeah, there's no data right now that suggests that BA.5 is more lethal or makes people sicker. In fact, it seems to be that it's no more dangerous. And again, the virus is not necessarily being selected for to be more lethal. That would be accidental. It's being selected for it's the racehorse that can out-compete the other horses and jump from person to person more efficiently. And if you're jumping from one person to another person more efficiently, you're going to dominate. And that's what's happened with BA.5. So it's not more deadly. And in fact, given the amount of COVID-19 we're seeing right now, it's just remarkable we're not seeing a surge, huge surge in hospitalizations or ICU. So we're seeing less hospitalizations than you would expect given the numbers. And of the people hospitalized, fewer people are in the ICU than you would expect for the number of people hospitalized. So we've built up some community immunity or herd immunity one way or another, probably both natural infection and vaccination, that's allowed this to be, for most of us, a nuisance cold or a bad cold.
Yeah, and I was just about to ask about population immunity, herd immunity, whatever you want to call it, because I feel like about a year ago that was like the number one thing I heard constantly in the newsroom was, are we at herd immunity? When are we? How far away are we from herd immunity? When are we going to get to herd immunity? And it would bother me because I'd be like, that's not what herd immunity means. But do you think that with the combination of natural immunity, knowing that BA.4, BA.5 are very good at subverting and escaping antibody immunity from B cell immunity, do you think that combined with vaccines, which we also know are a little bit out of date and aren't quite as effective at preventing against the Omicron subvariants, do you think that sort of sub-level of natural immunity and acquired immunity is enough to provide some sort of population immunity?
Yeah, it's a good question. In the beginning of the pandemic, we were hoping that we'd have vaccines that could provide us with immunity to infection. And we were also hopeful that once we did catch COVID-19, we would have a hard time catching it again. And the combined protection we would get from one or the other or both would lead to us being sort of bulletproof to infection. And what we found is that it's not the case, that because the variants of COVID-19 that have arisen and the variation in the virus, our immunity is imperfect. There's holes in our immunity. But what really has held has been the protection against infection. Has been the protection against infection leading to severe disease. So that's really key because we do have really good immunity, as we can see right now, against getting severely ill. And that's really, if you had to choose one thing other than infection, it would be protection from getting really sick. And we're fortunate to have that, because the reason we went into lockdown, the reason we did all the things we did to mitigate the spread was to prevent people from dying and prevent people from getting really sick. Now, we may think about, do we have to do that to prevent people from getting long COVID? But we haven't crossed that threshold now. So look, the bottom line is, we might feel we're done with COVID, but COVID is not done with us. We're gonna have other variants that are gonna come along, but hopefully over time, we get better vaccines. I think, again, many of us are talking about, the next generation of vaccines. The vaccines we have now, I always say, they're like the iPhone 1. They were the original OG vaccines against a variant that doesn't exist anymore, against the original variant. So we don't have that anymore. It's extinct. So now we have all these future generations that emerged that we need the iPhone 14. And it's probably going to be a nasal spray that protects the shiny surfaces of our nose from getting infected, plus maybe a vaccine that you get in your arm. Great. And hopefully just take it every once in a while instead of every 8 months. That's what we need. We need better therapeutics so that if you do get infected, you could take a pill and it makes you better and you could get back to work and it makes you less infectious. That would be great. I think that's on the horizon. So we have work to do. We have more to do. But right now, what can you do? Get boosted. It's amazing to me that a third of people eligible for boosters have gotten boosted. And that means 2/3 have not. And of people 50 years and older who are eligible for a fourth shot, only a quarter have. And again, people misunderstand. They think in absolute terms. Either the vaccines protect or they don't protect. They do protect you from infection. It's not as good as it used to be for previous variants, but for BA.5, your booster will protect you. It won't be 100%, but you'd rather have some armor, even if it's chinky armor, than no armor. So get boosted. That will help you, will help our country. So if you're eligible for a booster, please get it. I do believe the administration should allow boosting for everyone. Fourth doses. We should all be getting fourth doses now. It will protect us through the summer, reduce the rates of infection, further reduce the rates of hospitalization. And then a new BA.5 variant specific vaccine comes out in the fall. Sign us up. We should all get it as well. That's what we need to do. We really need to pile it on, not pull back.
Absolutely. I mean, I saw that in my own family. I mean, both of my parents got COVID. My dad was boosted twice. My mom was only boosted once, and she got far more sick than my dad did. Mm-hmm. And so that leads to a question that I did want to ask. You mentioned there, and I was just talking with Dr. Montefiore at Duke. We talked about the possibility of an Omicron specific vaccine in the fall. Do you think that people who are still unvaccinated, whether that's somebody who hasn't gotten the vaccine, hasn't gotten boosted, or that 6 month to 5 year population that just became eligible for the vaccine finally, should they bother to get, as you said, this generation 1 vaccine, or should they wait until the fall when we might have something more specific to what's circulating now?
Yeah, with the amount of COVID-19 that's being spread right now, it's crazy not to get boosted now or get vaccinated now. There's no strategic waiting. If we were in a very quiescent period of time where there was hardly any COVID-19 being circulated right now, we'd be talking about something very different. And a couple of months ago, that's sort of what we were thinking, that maybe this would plateau. We just came off a horrible winter. Maybe we built up enough immunity and we could wait. There's no downside. The vaccines are really safe. It's not like there's some accumulated toxicity. We haven't seen that at all. So why not get boosted now? The data from Israel on third shots are really compelling. There was protection for infection for 2 months and protection from getting really ill that continued to be seen throughout the study period as increasing. So I see no downside to getting boosted. I've gotten 4 shots. And I'm happy to get another booster by the end of the year.
Awesome. So can you, switching gears a little bit, talk a little bit, what is our zero value? Why does it matter? And, do you think it makes sense that BA.4, BA.5 might have a similar R0 value to something like the measles?
Yeah, so this is important. I'm going to plug in real quick because I'm
Yeah, no
worried
worries.
it's going to go down while we're talking. So R0 or R0 is how many people on average someone who's infected gets infected from that source patient, from that source case. So in order for an infectious disease to keep propagating within a population, you need at least an R0 of 1 or greater. You need to be able to give it to at least one other person on average in order to see this spread through a community. So for COVID-19, we've generally seen an R0 that started out maybe 2 and then turned to 4. And then for early Omicron variants, as much as 8, meaning on average in this model, each person with COVID-19 gave it to 6 to 8 other people. And I believe we're seeing something like that now because just look, you know people who've gotten COVID, people who are listening, they all know people who've gotten COVID within their families, themselves, their workplace. So it's just ubiquitous. But it doesn't mean necessarily that it keeps getting ratcheted up and up and up with every variant, or that we're at something like an R0 of 18, which is like measles. In fact, some models say that if you did have R0 of 18 right now, within 2 weeks, 105 billion people would be infected with COVID-19. And there's only, 7 billion people on the planet. We'd all have it by now. So it clearly doesn't make sense. R0 assumes that the population is susceptible. And as we just talked about, there's a lot of people who are not susceptible completely to getting infected with BA.5 because they've been vaccinated and especially boosted, or they've been infected with another variant that provides some protection, maybe not as good as we'd like, but some protection. So again, there's a wall that the virus has to jump over in order to infect enough people. So R0 is not 18 right now, it's lower, but it's pretty high. And we see that, especially now that fewer and fewer people are taking measures not to infect other people or get infected. So we're just making it easier for the virus to infect more people.
Absolutely. I mean, a friend of mine, she just had her wife and her wife's family in town, and she's pregnant, so she masked, and every single person in the family that was, except for her, got COVID. Yeah. But she was masked, so she has so far tested negative.
Masks make a difference. I mean, really, if people have to make decisions, and they are making decisions. So right now, decisions that are in your hands are, do I get boosted or not? If you're eligible for a booster, get boosted. If you're over 50 and you haven't had a shot since January 1st, it's time for a shot. So simple and easy. You should get boosted. It does help you. There's no downside, only positive. Number 2 is, at least indoors around other people, in public, wear a mask. It really does make sense. There's no reason not to. We are in a surge right now. It's not gone away. So that's another way to protect yourself, but also protect all the people you're going to likely infect, given BA.5 infects a lot of people, given someone who's infectious and spreading it. So we got to nip that in the bud, and we can't do that unless we take some protective measures. If we don't want to see a return to things like shutting down restaurants and bars, or even contemplating that, lockdowns, then we need to be masking. And I think it's a simple and easy thing to do. And it's a courtesy. And I wish it was more considered patriotic, because I think it is good for our country for fewer people to get infected. And it is an effective measure. Anyone who says it's not is just in denial. It really does help prevent. It's a barrier method, and lots of people are into barrier methods for lots of different infectious diseases. This is a barrier method for preventing COVID-19 spread and acquisition. So those are simple things you can do right now that are not horrible, and until we get better vaccines, which again, I expect we will.
Awesome. So, you kind of just touched on this, and we were talking about it when we first got on the call, but, we keep hearing people say, the pandemic is over. We got rid of masks mask mandates, mask requirements, or even mask suggestions in a lot of counties and cities and places where when we have high transmissibility, even according to the new CDC guidelines. So why, and then, we're expiring our COVID state of emergency. Why are so many people saying that the pandemic is over when we have such high transmissibility variants? And as you said, we're currently in a surge.
I think people are acting emotionally, and I think people are tired. It's been a long few years. This has had a tremendous impact on us on many levels. And we're all impacted to some degree in our mental health by this. No one's had a good time of it. So this has been hard. And I think there's some wishful thinking here. Look, there's across the spectrum, there's the zero COVID policies of China that's doing everything it can to prevent the spread. They've had relatively very few deaths in a very populous country. So it's paid off, but there's been a huge cost. Our country has decided to go pretty much the opposite way, which is we're willing to take it on the chin. We're willing to lose old people. We're willing to lose immunosuppressed people. We're willing to be out of work and have schools shut down. We're willing to do that. We're willing to have some people have long COVID because we want to get back on with our lives and with our communities and societies functioning. That's a value judgment. So even if you do decide that, you shouldn't say that it's over. We clearly have the virus spreading. Clearly it's impacting us. People are getting sick. Most of us are recovering just fine. Some of us not so much. And we are losing people. It's 300 people or so a day. It's probably going to go up a little bit. But that's the price we're paying. And America has said that's okay. And our leaders have said politically, we have to do that because there's so many people who are just basically almost in revolt against doing things to the point of denying factual evidence of things that work, just so that they can get back on with their lives. And I think it's a self-protective mechanism. So there's some denial going on here.
I wonder if we could get into a little bit more specific of the immune response as it relates to COVID-19. So, can you explain a little bit why T cells are so important in the immune response and why that means that if you get vaccinated and boosted, even though you're using the first generation vaccine, you're still going to have some level of protection?
There's a couple of things that we know for sure. And then there's some things that seem to be happening that are very interesting. One is we have two basic arms of our immune system. And one is based upon B cells, and B cells make antibodies. And antibodies are, if you think of it as like missiles or arrows that are being slung at a new pathogen that's come into your body. And they literally attach on to parts of in this case, virus. And in this case, the spiky part that the virus uses to enter our cells. So that's good. So our B cells, when we get vaccinated, get primed to make antibodies against parts of the virus that we see right away when we get infected, and hopefully allow you to be infected and not even know it. Virus comes into your nose or your throat, your B cells say, hey, I know what this is. I've seen it before, and makes antibodies that knock it out, neutralize it, neutralizing antibodies. The other thing that happens when we get infected or vaccinated is T cells, another arm of the immune system. And they are not so much sending missiles, they are sending out the lions. Like they come along and they gobble up, infected cells and germs. So this is like Pac-Man coming along and going, and it takes a big bite and there goes the cell that's infected. It gets all lysed, chewed up inside of an acid bath inside of the cell. So again, those cells can be very specific. They recognize a particular antigen, meaning a particular thing that's different than what we're used to seeing. So both sides of the immune system get trained and primed. What's very interesting is that there's some work that's been done that looks at our B cells and our antibodies and says our B cell responses and our antibodies actually evolve after infection or after vaccination. you're not just making the same old antibody time and time again, but your antibodies actually are getting better over time. That may explain as well why people are not getting hospitalized after they've been vaccinated. They're getting infected. So it's not being able to protect them from getting infected, but it is definitely protecting them from getting hospitalized. Plus those T cells, they seem to last a long time. So B cell responses, those antibodies, you're not supposed to keep making antibodies after you get infected with something. It should quiet down now that the threat is gone. So it's no surprise that we get vaccinated and the antibody levels peak and then over time wane. You don't want to be swimming around in antibodies all throughout your system all the time, because some of those could cross-react with yourself and then you get autoimmunity, which the body doesn't want. So it's purposeful that antibody levels generally decline, but if that B cell sees something that looks familiar, it could explode and make lots of antibodies. Those T cells, they stick around a long time. They're always on patrol. And so that's another reason why we see the lasting power of vaccination against hospitalization, more so than even infection.
Awesome. That's all the questions that I had. Is there anything else you want to add or anything you think I should have asked you that I didn't?
No, sounds good.
Awesome. Thank you so much, Dr. Wohl. I so appreciate you.
Anytime. Thank you.
Thanks so much. Have a great rest of your day.
You too. Bye.
All right. Bye.